Welcome back to Today's Health. Today we're talking about arthritis of the hip with Dr. Scott Heithoff. Dr. Heithoff, before the break we talked about the non-surgical treatment options. Now let's get a little bit into the surgical options for arthritis of the hip.
Sure. When a patient comes to me and they have hip arthritis and we've gone through the non-surgical treatment options and they're not getting better, or over time it continues to get worse, then we start talking about surgical treatments for the hip arthritis. And the good news is that surgical treatment for hip arthritis, which would be a hip replacement, works very well. Typically will give a patient 90 to 95% pain relief after the surgery, which is pretty dramatic, especially when the arthritis is severely limiting their activities of daily living and just their quality of life.
Now, what determines which procedure is performed? Are there different types of hip replacement surgeries?
There are different types. Sometimes it has to do with the patient themselves. Some patients are able to have certain procedures, some are not. It also depends on the doctor's preference. Some doctors are more comfortable doing certain procedures than other procedures. But the mainstay treatment for hip arthritis surgically is a hip replacement.
Well, let's start with a traditional total hip replacement. Can you describe what happens in that surgery?
Sure. Let's look back at our diagram here, just a review of the normal hip and the arthritic hip. So when we're looking at the arthritic hip, we're noticing that this cartilage is worn, it's uneven, and this is what we're really looking to replace, is the ball and the socket of the hip. So what happens during the procedure is that essentially what has to be done is this arthritic ball at the top of the femur needs to be removed, and then the socket part, which is also arthritic, will have to be replaced as well. And these are done with certain instruments to create the space necessary to put the hip replacement in. So these are kind of some pictures of what the replacements typically look like. So as far as the socket, there's typically a metal socket that is placed in the pelvis. Sometimes there's some screws that help hold it in the pelvis. And then there's a plastic liner that fits inside that metal shell. And on the femur side, there's a pin that goes down the middle of the femur, and then there's a ball that replaces the normal ball at the top. This ball is sometimes made of metal, sometimes it's made of ceramic, but essentially it's either ceramic or metal ball with a plastic liner. And then here you can see the final picture of before and after. You can see the hip anatomy is recreated with the metal and plastic as opposed to having the arthritic cartilage.
Now, are there any updated techniques to the traditional hip replacement surgery? Sure,
and generally hip replacements have been done two different ways. One, it kind of depends on how you get to the hip. So there's a lateral approach, which goes from the side, or a posterior approach, which goes from the back. And those have been traditionally used for many, many years. Now recently, because of technology, we've been able to do the surgery from the front, or an anterior approach. And for the past 4 years, that's how I've been performing my hip replacements. And I found it to be quite advantageous for the patient. And the benefit of it is that going anterior, we're not cutting any muscle, we're just pulling the muscles to the side to get down to the hip joint, which allows for a much faster recovery.
So it sounds like that is, it helps them to heal quicker, it's a easier, better procedure to have. What would be the anticipated hospital stay and recovery time for both types of surgery?
Well, with a hip replacement where we're going from the lateral or posterior aspect, typically patients are in the hospital anywhere from 2 to 4 days with that. With the anterior hip replacement, usually 1 to 2 days. So we're knocking off a whole day hospital stay from that. And plus with the anterior approach, we're able to get patients up the same day of the surgery to start walking. And their pain level is a lot less because of no muscle injury during the surgery.
Now, how long is the new joint expected to last?
Well, generally a hip replacement will last 15 to 20 years. And that there's a lot of things that can affect that time. You know, the patient's activity has a lot to do with it. The more active they are, the quicker it'll wear out. The bigger the patient is, the more that joint will wear out as well. And when we're talking about the hip wearing out, we're talking about the plastic liner that we saw before. And over time, as that hip's moving, that plastic will start to wear. And so generally when a hip is worn out, we can go replace that plastic piece and not have to replace the rest of the hip.
Doctor, this has been great information. Do you have any closing comments for our viewers today?
Well, I just want to let people know that if they're having pain in their hip, whether it be in their back, their side of their hip, their front of the hip, it's definitely worthwhile to get that checked out. It may not be anything serious, but sometimes just knowledge of what is going on and what can be done, it could be very helpful.
And there's no need to live in pain if there's something that can be done to change that.
Correct.
Doctor, thank you for joining us today.
Thank you for having me, Michelle.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear about, you can contact us by calling 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.